Today in the CST session, we will have multiple aspects of ACT. What is sluggish cognitive tempo? What is the diagnostic factors? What are the overlapping comorbidities? And what are the presentations with coexistent diseases, and what are the differential aspects of it between ADHD? Well, patients with ACD show clinical symptoms like daydreaming, feeling low energy, seeming like confused, and it's a failure of cognitive stimulation. And these children are defined as ineffective, sleepy, slow, confused, lethargic, apathic, or hypoactive. They have actually slow in terms of perception. And in clinic, we see them as ADHD patients, but actually they are a different group of patients. When we have a look at the history of SST, and in a journal in 2018, there are two definitions. One of the definitions is overlapping and equivalent of the ADHD, and another one is the low energy level, actually low attentiveness and non-responsiveness to social interactions. And actually, it's similar to the schizophrenia, and actually it was it was seen at the earlier times than we expected. And ADHD was an executive motor dysfunction, and the first studies actually showed that in the DSM-3 was the differentiation of the DSM-3 was an important development, and the first model studies was conducted in 1980s with the differentiation of symptoms. And there is a study of 1985. Study conducted was on 20 children in the non-ADHD group. Concern, anxiety, non-responsiveness to stimulators, and slow motion was actually less. But in the hyperactivity group, there were more problematic cases in terms of social interaction. And the other studies actually showed the same results. And there were no subgrouping was done. And actually, in other studies, it was mentioned but not included in the DSM-3. It was firstly seen as a sub-definition, and in 2013 and 2020, most of the people claimed that it's another definition, being sluggish or daydreaming, but all of the concepts were actually included. And it might be called like a primary vigilance disorder. This was one of the suggested concepts, but now we call it as a sluggish cognitive symptom. And reliability of ADHD subtypes were analyzed, and we had three main factors in DSM-3: attention deficit, hyperactivity, and sluggish tempo factor. And two patients group of ADHD-C and ADHD-1 type features with the same level of attention were compared, and SCT symptoms were observed more in the ADHD group. Well, although SCT was firstly thought as a subtype of ADHD, actually recent studies proved that this hypothesis is not valid. It's a separate disorder. And in DSM-5, it's not included as a separate diagnosis, but it causes disagreements and controversies in the literature. In research, actually in ACT cases, ADHD can be seen thereabouts by 59%, and in the non-ADHD diagnosed one, the rates are different. What are the diagnostic criteria. I mean, we need a diagnostic validation and the long-term stability, and the symptom cluster should be differentiated from other diagnoses. So we have some diagnostic validation studies until 2019. From 1999, the studies were conducted, and up to 15 we have lots of factors. The most actually, these are the symptom clusters that we see most commonly, and they are special to SCT. For example, daydream, trouble staying awake, and people stares blankly into a space, and lethargic. When compared to peers, they are more underactive, they are slow moving, and it looks like they cannot process questions or explanations accurately, and they are lost in their thoughts. These are the symptoms, cluster of symptoms, and actually it's compliant with the previous studies. And actually, the former research of SCD symptoms have had differences with ADHD and ADHD1 subtypes, and especially two symptoms are distinctive for SCT. One is daydreaming, and the other one is being drowsiness and sleepiness. So this is the Barclay's questionnaire of attentiveness in children, and with the validation with other studies, this is the scale of monitoring the symptoms. This has the Turkish version, and in this questionnaire, the Turkish version of it is the validation. Actually, one of the speakers is included in this group. According to the symptom levels, actually it was defined and it's validated. And for SCT, in many studies, we have the child behavior checklist. In a teacher and parent scale, some actually list like daydreaming, being drowsiness, being confused, or drowsiness, lethargic forms are actually seen in the monitoring process, and if they are above the points of 3, then it's an important factor. Well, in terms of etiology, I will be giving information about my aspect. While SCT symptoms occur more often in prenatally alcohol-exposed children, maternal smoke, and childhood leukemia. And SCT is also linked to greater family and child psychosocial adversity, and social stressors may be related to SCT, they say. And what are the demographic differences between SCT and ADHD? And actually we need more prevalence studied. We have an actual prevalence study, and the rates change between 4 and 10%. And actually Turkey's ratio was 10.4%, and I think we need further studies. And males are more common in ADHD, but for SCT, it's nearly equal for both sexes. Some publications say that females are dominant, but in generally they are nearly equal. And SCT symptoms increase slightly with age, and may have a later age of onset of their symptoms, and ADHD symptoms decline or remain stable with age. And SCT has relationship with a low level of patient education, lower yearly wage and ratio of invalidation, and more parental divorces. And SCT and ADHD are overlapping frequently, especially we have an overlapping in the subtype of ADHD1. Two are relatively distinct, but at the same time they are related disorders, but they are not one of the subtyping within a common disorder. And When we look at the comorbidity in SCT, we see the prevalence of internalizing symptoms, and they have less of externalizing symptoms. They have more anxiety, and their social phobia is more prevalent. And SCT can be protective factor for ODD, and actually it is negatively correlated with substance use, and the motor problems actually seen equally with the ADHD. And 50% of ADHD cases had prior diagnosis of it, while 14% of SCT cases had diagnosis of ADHD, and only 25 of them are combined ones, like SCT plus ADHD, and this is the result of a wide range and study. And in our clinic, if we see ADHD and SCT, this is the study, and we have 55 combined cases, and ADHD cases actually the age of 6 and 70. And if actually the point is above 23, then we have significant differences. The combined group's age group was more greater, and internal problems were more commonly seen. And when we look at the external findings, actually impairment is very commonly seen, but we have less studies. In one study, SCD, ADHD, and control group, the evaluation was done in terms of impairment. In control group, it was the lowest, but in ADHD, the impairment was more or less seen in the school environment. So what about relationship of anxiety with SCT? We see a greater risk for anxiety as the SCT findings and indicators are higher. Then we see the anxiety level is increased also, and the severity is also increased. And in terms of ADHD, we see more risk of depression in SCT. And sometimes we see higher comorbidity risks, and we should actually evaluate them as two separate disorders. And when compared to anxiety, we have higher risks, and SCT seems to be more strongly related to the depression than to anxiety. But however, this may be more true in children than in adult patient groups. Well, in this respect, there's a study from Ward, and actually 342 adolescents were included, and the average age was 13. We have some depressive symptoms and conflict with parents, and depressive symptoms increase while the SCD symptoms increase. And there are clinical significant depressive symptoms are related to conflict with parents, and ADHD levels are also high. And so this is similar to the Barclay's study. This is compliant with Barclay's study, and hyperactivity is higher than impulsivity. Well, in these children, we have some risks, and there are significant increase of suicidal risk. And actually, we have 95 patients, children patients, and when we look at the symptoms, SCT is correlated with the suicidal risk in children, and another study was done of the suicidal behavior in children. Over 1,000 college students were included, and actually SCT was the most correlated factor for suicidal behavior. And SCT, including depression, beyond them, is related to the suicidal behavior. So what about academic impairments? We don't have actually consensus on that. It's controversial. Even if they are controlled, impairment of academic performance might be seen in the future, and we have equal risks for learning disorders with ADHD. In the parents of SCT, actually, they are less stressed, but actually they are stressed about school, anxious about school the most. We know that SCT children have problems about reading the social cues, and the study was done in 51 autism spectrum disorder adolescents, and when age and sex was controlled, only SCD symptoms were included, and only ADHD symptoms. And we can say that SCT and ADHD was increased independently. And when it comes to the social emotional impairment, they are pretty anxious in terms of being a part of social groups. And actually in SCD groups we have limitations in terms of social internalization and introversion. And SCT symptoms predict increased peer problems across the duration of a school year. But even after controlling for other psychopathology symptoms and initial levels of functioning, and we don't know if it's due to shyness or social interest, we don't have a consensus on that. And SCT is associated with both social problems and depressive symptoms, and it's not surprising that it has also been linked to problems in regulation of emotions, but this is still controversial, and we need more follow-up studies. And SCT is also related to global impairment, but it's not as severe as ADHD, and they are less common. And actually it's clear that SCT is associated with functional impairment not explained by any overlap with ADHD, and SCT is also linked to increased stress and poorer quality of life and socioeconomic status. Well, lastly, this is a recent study, 10-year follow-up study. And for the diagnostic validation, there have been 6 studies so far. And the longest one actually lasted for 2 years, and this is the 2 years study. We have a total sampling over 1,000, and it looks at the diagnostic stability and diagnostic validity. It says that in ADHD and SCT are stable in terms of diagnosis, and the symptom dimensions are related to each other, but they can be separated from each other. And impulsivity symptoms are more correlated with the ADHD, and in terms of developmental process, they can be differentiated from each other. In 10 years of the follow-up, they were evaluated by 6 times. In 10 years, the hyperactivity symptoms were lower. SCT has the inclination of increasing mildly. Thank you for your attention.